Today is July 15th, 2020. My name is Anthony Villanueva. I'm interviewing you for the Voces Oral History Center at the University of Texas at Austin. Please know, Ms. Cisneros, that this interview will be placed in the Nettie Lee Benson Latin American Collection at the University of Texas in Austin. If there is anything that you do not wish to answer or talk about, I will honor your wishes. Also, if there is something that you want to talk about, please bring it up and we will talk about it. Because we are not conducting this interview in person, I need to record your consent. So I'll ask you a series of 5 questions. Please say yes, I agree, or no, I do not agree for each one of them.
Okay.
Voces is to archive your interview along with any photographs or other documentation at the Benson Library at the University of Texas in Austin. We will retain the copyrights for the interview and any other materials you donate to Voces. Do you give Voces your consent to archive your interview and your materials at the Benson Library?
I do agree.
Thank you. Do you grant Voces copyright over the interview and any materials you provide?
I agree.
Do you agree to allow us to post this interview on the internet where it may be viewed by people around the world?
I agree.
If any one of those questions is no, then the deal is off. We have many questions in the pre-interview form. We've completed the pre-interview form. On occasion, Voces receives requests from journalists who wish to conduct our interview subjects. We will only deal with legitimate news outlets. Do you give your consent for us to share your phone number or email with journalists?
Yes, I agree.
Okay. So that's the preamble to the interview. And what I'm going to ask you to start off the interview is just to tell me a little bit about yourself, from whatever you want to discuss about yourself.
Okay. Well, I was born in Mexico. I lived there till about I was 5 years old. Then we moved to Arizona. I was raised in Arizona. I went to school in Arizona. It was me, my mom, my dad, and my brother who was born after me. And then in Arizona, I had 3 more siblings. After a few years in Arizona, we moved back to Mexico. My dad passed away, and then a couple of years later, I got married and moved back to the United States with my husband. I lived here in Elgin, Illinois for the past 30 years. I have 3 kids, all grown up.
And when you moved back the second time from Mexico, did you move right to Elgin or did you live someplace else?
I moved to Arizona, my home place. Lived there for almost a year, but my husband never got accustomed to the heat.
Oh, okay.
So we moved to Elgin because his brother was already up here, and he talked him into moving up here and trying it out and see how it went. So we ended up moving to Elgin back in 91.
Do you remember what year, more or less? What year was that?
91.
91. Okay. And how did you first learn about the COVID virus? How did you first learn about that?
I listened about it on TV. That's where I learned about it, through the news at work, actually. we watch the news channel all day at work. I'm a dental assistant. So we have a TV on all day for patients, and that's the first time I heard about the virus. I think it was back in January. It was either late December or January when I heard about it. Didn't give it much importance to it, but that's the first time I heard about it.
Okay. And did you think, at the time that you heard about it, did you think it was serious?
At the first time I heard about it, no, because it was in China back then. Never thought it would have become what it has become because of other viruses that have been through the years, like the West Nile virus, or there's other viruses. I can't remember the names right now, but I know the West Nile was one of them, and then we had the oh gosh, can't remember the names, but none of
The
them.
swine flu?
The swine flu, yeah, and so there was not those. Even though there was a couple of cases in the United States, it was nothing big. So I thought that it was going to be like one of those viruses that we had before.
And then at what point did you realize that it was serious?
When New York started getting very infected, and then there was more cases growing through the United States, and then they were talking about how contagious it was, and that's when I realized it was something bigger than what we thought.
Okay. And did this before we get to the impact in your family, I'd like to discuss, did it have any impact on your job?
It did. We were closed for almost 2 months. We closed in March and reopened back in the end of May, May 29th. Throughout that time, I only worked maybe a couple hours a week because we were only seeing emergency patients. We were not allowed to do any regular procedures, just get the patient out of pain, and that was it.
And your job is located where?
My job is located in Arlington Heights, Illinois, about half an hour away from my home.
And while you were at your job, did you interact with patients directly?
Yes, I did.
Were any of your patients, did any of your patients discuss their concern about the COVID virus?
Yes, a lot of them did, especially older people, because at that time, for what we were hearing in the news, the more impact was on elderly people. So our elderly patients were some sort of concerned. They were a little bit scared of it. Yeah, so we did discuss a lot with them.
And in conjunction with your job, were you tested for COVID?
Yes, I was.
How many times?
Twice.
Twice. So none of your patients came in positive for COVID or demonstrated symptoms of COVID?
No, not that we know of. There was a couple, they did have symptoms, but they never came in. They would cancel their appointments and they would tell us what they were feeling. So we think they had COVID, but we're not for sure.
And while you were at work, did you feel safe at work?
No, I didn't.
No.
No.
Did you have enough PPE?
Yes, we did. We always did. Doctor was very precautious about that since we started hearing about the virus. But even though having all the PPE that we needed, it still didn't make us feel 100% safe.
And did you feel that your ability to be bilingual, did that ability help you at work?
Yes, it did. It helped me a lot.
Okay. Now, let's talk a little bit about how COVID impacted you directly. Did you contract COVID?
Yes, I did. While at work, I started feeling sick one day, towards the end of the day. I had come in for a couple of emergencies that day, and I was finishing up when I started feeling my body with a weird sensation. It was nothing normal. Didn't give it much importance to it. But then when I got home, I started feeling really tired throughout the evening. By the end of the evening, I had a fever. So the next day, I called my doctor and they sent me to get tested, which I came back positive.
Okay. And how fast did those symptoms manifest themselves with you? In other words, you felt sick at work and
Well,
you
since I
got
started
home
feeling
within hours, within 2 hours, or at work you felt sick.
at work, yeah, it was about an hour before I was going to leave work. I started feeling weird. My body was feeling weird. Within hours, I had a fever. By this time, I was home. So this was probably about 3 to 4 hours after that. I had a fever. I called out my boss and I told him how I was feeling. And I called my doctor too. And then after that fever never went away for 11 days.
How high was the fever? Do you remember?
It was between 102 and 104 every single day.
Okay. And how did that progress? At what point did you start feeling better? How long did it take for you to feel better?
11 days.
11 days. And during that time you were quarantined at home.
I was quarantined at home for almost 3 weeks, but I was in the hospital for 5 days.
Which hospital?
Sherman Hospital here in Elgin.
And how did they treat you at the hospital?
They treat me very good. I feel that they did a very good. They put in a lot of effort in trying to take care of me. Antibiotics, vitamins, every single day, different times of the day, just to get me to get my immune system back up.
And were you on a respirator?
No, I was just on oxygen.
Just oxygen. And during your hospitalization, at what point did you start feeling better? How many days into your hospitalization?
3, almost 4. By the end of the third day, I started feeling a little better. The fevers were down at 101, so I wasn't feeling as sick. My chest, though, was still feeling very weird. It was a very weird sensation that I was feeling in my chest. I had never experienced anything like that before. Then by the fourth day, after, it was like the last time I had a fever was like 2 o'clock in the afternoon.
Right.
And after that, the fever went away and I started feeling better. So the 5th day I was in the hospital, they were just watching me. I was just an observance.
And after you left the hospital, do you still feel nervous to be around people? Do you ever think that you might get it again?
Well, no. My doctor and at the hospital too, nurses and doctors told me that my body was immune to it now. That for 2 or 3 years, my body was going to be immune to it, so I wouldn't contract it again.
Okay.
I was not feeling nervous to catch it, but I was feeling nervous to be able to transport it to somebody else.
Right. So that's your concern now, that you could pass it on without even knowing.
Exactly. Yeah. Or even though I have not heard of anybody contracting it again, the virus has shown so many different symptoms on everybody, and it seems that it hits everybody different. So at this point, with everything going on and everything I hear in the news, I am kind of scared that I can contract it again, because you never know.
Yeah. And you spoke about the news. Do you follow it? Do you follow the news on the COVID updates every day?
Not as much. Actually, for like 3 weeks, I never watched the news. Um, Now I do every now and then, even at work, doctor will change the channel because of me. I don't want to listen to the news.
Right.
It bothers me. It hits me when I see the numbers that keep on going up, and to know that my mom and my brother are part of those numbers, it's
Okay.
very painful.
Now, is there anything else about your job or your experience with COVID that you want to talk about, or can we move on to your children?
We can move on to my children.
Okay. Now, how many boys do you have?
3 boys.
2 boys. Were any of your sons affected by COVID?
Yes. My oldest one, even though he never got tested, because he started feeling a few symptoms way at the beginning when there was not much testing around. And then he was exposed to somebody that had come back positive at work. So he was quarantined for a while, but he wasn't able to get tested. But we think he had it. My youngest son, he did come back positive. I believe he got it from me, because he lives here at home with me. But he didn't experience any symptoms. But 2 of them, he lost his smell and loss of taste. That was it.
Did those senses come back?
Yes,
Or
they
he
did.
come back?
Yeah.
Okay. Do you want to talk to me about your brother?
My brother, he
What
was
was
a
his
young
name? What was his name?
Simon Zamudio.
Oh, Simon.
Yeah.
And, and what branch of the military was he in?
He was in the Army.
Okay. Was he on active duty when he contracted COVID?
Yes, he was in active duty. He was a sergeant. He was going to be deployed in June.
Mm-hmm.
I'm not exactly sure where. I know he was being deployed out of the country, but I'm not exactly sure where.
Where was he stationed?
He was stationed in Arlington Heights.
Right here in Illinois?
Right here in Illinois.
Okay. And how did the COVID manifest itself with your brother? Does he know where he contracted it?
Not 100% sure. My mom was actually sick before him, but then she got better. So it was really weird. We're not exactly sure how she contracted it or who contracted it first. But when he took my mom to the hospital, he got tested too. At the same hospital where he dropped off my mom, they were testing. So he got tested there and he came back positive. But he didn't experience any symptoms for like 12 days. He was fine.
Mm-hmm.
He would even joke about it and say that they had probably made a mistake with him because he felt normal, that he would say that he felt really strong and like a superhero.
Yeah.
So that he thought the test was wrong.
And at what point did it get more serious for your brother?
I spoke to him on a Tuesday. This would have been Tuesday, the 19th of May. I got out of work and called him up Me and both of my brothers, we were on a three-way line, and that's when he told us that he was feeling a little bit sick, that he was really tired, and that he had a light fever.
Okay.
So by the next day on him, it progressed very fast because his symptoms started getting worse, the fever, the tiredness, the acheness in the body. By Wednesday night, around 10 o'clock at night, his wife took him to the hospital because he was feeling
Right.
sick.
Yes.
They let him out of the emergency room at 4 o'clock in the morning because according to the hospital, his oxygen level was good. They just gave him some antibiotics and sent him home. On Thursday morning, I was at work, and he would call us every day with the hospital updates on my mom. That day it was past 10 o'clock in the morning and I hadn't heard from him. So I texted him, and it took him a long while to answer, which was not normal from him. Then he called me up right about 11:10 in the morning and asked me to call the hospital and find out how my mom was because he was feeling so sick that he couldn't be on the phone. And at that time, I realized that he was very sick because he could hardly talk. And that's when I found out that he had been released from the hospital because I told him, I went into panic mode just from listening to him, how he was. I told him to go to the hospital. I told him he was very sick. And he said, well, no, I did. They sent me back home. They put me on antibiotics because I'm just gonna like go back to bed and rest
Right.
um, and see. That night, he went back to the hospital at around 11:30. His wife dropped him off at the emergency room again. And not even an hour later, he passed away.
Oh my goodness. I'm so sorry to hear that. So, do you feel that the hospital somehow dropped the ball on this?
Yes. Yes, because I had it. I know what it felt not to be able to breathe. And there is no way my brother had normal oxygen level. By the way, I heard him. I mean, I could even hear the wheezing on his voice when he was talking. I know for a fact that his oxygen level was not normal. He should have not let sent home.
I know that this is very painful for you, so I'm not going to keep you uh, talking about your brother unless you want to. What I'd like to do is move on to your mother. Your mother, during all this events happening with your brother, was your mother still in the hospital at all during this time? Can you
Yes.
tell me? Can you tell me a little bit about your mother's COVID experience?
Well, like I said earlier, she had been sick for almost 2 weeks, probably at home. She lived with with one of my sisters. Um, my sister was very sick too, and so was her husband. Her husband came back positive. My sister came back negative, but had all the symptoms, which was really weird. My mom, when she was admitted to the hospital, she wasn't feeling that sick. She was actually recovering already. My brother took her to get tested because of my everybody at home being sick. So he was concerned because of her age. So he took her in, and they kept her because they said she was positive and her sugar level was very high. She was diabetic. So they kept her in the hospital. Um, a week into the hospital, or like 5 days into being admitted, she was intubated. So she was on a ventilator. So she didn't even know that my brother got sick.
Right. Before we move on, how old was your mother?
My mother was 70. She had just turned 70 in April.
And your brother was how old?
My brother was 34.
And when you lost your brother and you lost your mother, um, how did you and your family react to these losses like back to back?
It was very painful. It's still very painful.
Mm-hmm.
Losing two family members only 2 days apart is really hard.
Mm-hmm.
It's something that nobody wants to go through.
Right.
And I know that out there, there's so many people going through this pain of losing their family members, sometimes more than one too. But it impacted the whole family really bad.
Mrs. Cisneros, do you want to take a break? You want to go get a glass of water, or you?
No, I'm fine. It's
You're
okay.
okay?
Yeah.
Because if this is, I know this is painful, but you can stop this interview at any time if you feel like you can't.
Yeah, that's fine.
Okay. And now, uh, like we said at the beginning, uh, you have some photographs that you're going to send me so I can put them on as an attachment. Is there anything else that you want to talk about in terms of uh, the COVID experience? Maybe how has it impacted your religiously? Has it impacted you? Has it prevented you from participating with your congregation?
It's impacted us because we cannot reunite as we did before. I miss all my brothers. I miss going to the meetings. We're not able to go out and preach as a Jehovah's Witness. That is our main what's the word I'm looking for?
It's the center. It's the epicenter of your life.
Exactly. Yeah. Sometimes the word just leave my.
I know. You're under a lot of stress right now. I understand.
Yeah. So not being able to do it, it's impacted all of us around the world.
Okay. All right. I know this. I'm sorry if this brought up some very hurtful memories, but I'm not going to prolong your pain. Is there anything else that you'd like to say? Anything you'd like to talk about? Maybe I didn't ask you, in your community where you live, in your neighborhood, has it impacted your interacting with neighbors?
Yes. Since back in March, towards the end of March, we don't interact with the neighbors much. We only see them from far away and maybe just wave at each other, and that's it. I don't know how deeply they've been impacted, if they've had any losses as well. But yes, it's impacted the community around here.
Okay, and your neighborhood, are the homes close together or are they further apart?
They're close together. They're probably about maybe 13, 14 feet apart.
Okay. And how about your day-to-day activities like shopping for groceries or going out of the house? Has the COVID impacted your ability to go out and shop?
Yes, it has. Well, we try to avoid going to the store as much as we can. We try to do our shopping as less as we can. It's the way we shop now with so many precautions. It's time consuming.
Mhm.
It's stress consuming.
Right.
Now living with that fear that you can even contract it from a can, a can of food, or even the vegetables or fruits, whatever.
Right.
It is very, very concerning.
And how concerned are you when you see somebody not wearing a mask?
Very concerned.
Yeah.
Very, very concerned. I try to, I tell my kids all the time to wear the mask all the time, wash their hands as much as they can. Um, Even when we go and get gas for our vehicles, I encourage them to use gloves. I try
Yes.
to use gloves all the time and dispose of them before getting into my car. Um, Going through what we went in our family, I think it's scary for me. It's very scary for me to think that anybody else of my family can contract it,
Mhm.
and it's something I don't want to go through again.
Mhm. Is there anything else you'd like to talk about? Because if not, I think I'm going to stop here.
Okay. Um, well, not really. It's but I don't know how soon this interview will be available to other people, but if it's soon, I hope that they take action and take this virus as serious as it is, because it is something, it's something real. It's something that um, it affects the families for the rest of their life.
Right.
I know that there's people, I have a couple of people that I personally know that contracted as well. One of them has permanent damage to his lungs. So it's something to be concerned about. It's something to be scared about, and it's something that we need to take precautions, wear our mask, and not just be cautious for ourselves, but for other people.
Okay. Um, just to give you some insight on the procedure going forward, once I close this Zoom interview, I send it in. I send it to Texas, to the University of Texas. They'll they'll produce a transcript of our interview, and I'll go over the interview transcript along with the recording to make sure that all the words are exactly
Okay.
as we discussed. Then it's taking like maybe 2 weeks before they upload it onto YouTube. And
Okay.
when it's posted, I will let you know, so you can just go in and look at it. And it's something that will be available to anybody and everybody around the world. It'll be available for your children and your grandchildren and generations in the future, uh,
Okay.
so they can see you as we discussed our discussion today. So with that in mind, I want to thank you. I want to apologize to you in case I brought up some very difficult memories, but I thank you, and with that, I'm going to close the meeting.
Okay. Okay.
You have a
You're
good day.
welcome.
Okay, thank
Thank
you
you. You
very
too.
much. Okay, bye-bye.
Thank you. All right. Bye-bye.